Hi, these are difficult times due to the SARS-CoV-2 pandemic, and we all need to ensure our safety and a healthy lifestyle. I deal with the spinal problems, and it is important to reflect how we can also prevent fresh episodes of spinal ailments, especially during this time that we are sedentary in our homes during the lockdown period, and we are also predisposed to bad postures because during idling we need to be on the bed for long hours or are using the sofa etc. for long hours. As such, also spine problems are very common. They are the second most common ailment after common cold, and we all should be taking some preventive measures to prevent spinal problems from coming. So what can you do in these times of difficulty to stay away from spinal problems so that you don't need to visit doctors? One of the very important things is that you should engage yourself in general conditioning exercises, and especially those which you can do within the house in this period of lockdown. So you could either walk continuously in the house, starting with whatever is comfortable and gradually building it up till you are doing around 50 minutes of walk at a stretch, or its equivalent of treadmill, cross trainer, stepper, etc. These are the most important exercises that you could be doing. Of course, you could also do some back stretching exercises. The examples of there are widely there on the internet. But it is very important to avoid any such exercises which increase your pain. So any movement which increases your pain, avoid that movement. Another important thing you can do to prevent spinal ailments is maintaining a good posture. When you lie down in the bed, you should not slouch in the bed. Your mattress should not be sagging. Avoid working on the laptop for long hours on the bed. When working on a computer, ensure that you are working on a desktop, preferably. And if you have to work on a laptop, see that you use one with a detachable screen. The monitor should be as much at eye level as possible, and the keypad should be preferably on the table, on the or on the attachment under the table. When you sit on the chair, ensure that you use a good quality chair. The angle between the seat and backrest should be fixed, that is around 100 to 110 degrees. And take your buttocks right back to the backrest and sit with support. Don't sit unsupported for long hours. Don't slouch on the chair, and every 40 to 50 minutes, change your posture so that pressure doesn't build up on your back muscles. Another important aspect which predisposes you to back pain and spinal problems is stress, which is natural during this time of the pandemic. This will lower your threshold to withstand pain, and hence, if possible, you should do some stress relaxation exercises or meditation which keeps you mentally healthy. So, friends, you should follow these prevention measures to reduce the chances of spinal problems. However, if you have a severe episode and you can't manage with anti-inflammatories, with hot fermentation, some local gel, or if you have any of the red flags, whereas if you have fever associated with back pain, or if you have difficulty with bowel and bladder control, or pain travels down the leg or the arm, or if you have weakness in the legs and the arms, you should immediately contact a casualty of a nearby hospital. Of course, there are various telemedicine options nowadays to take consultation while you are at home. But the best thing is prevent these problems, and they say prevention is better than cure, holds very true for prevention of spinal problems. There are some of our friends with spinal problems who have had a neurological deficit and are on a wheelchair. They are especially vulnerable and predisposed and should be taking special precautions. We'll try to cover this up in a separate edition. So, while you are at home, follow the universal precautions that are required to stay safe from the COVID disease. Stay at home, stay safe, stay healthy, and prevent various spinal problems. Thank you.